There was a phase 1 trial that we published in 2018 in last May, but later last year the pivotal trial was published in leukemia, and it was found that about 40% of the patients could achieve complete remission with this agent, Moxetumomab Pasudotox. And most of the complete remissions were MRD-free. And so this was an agent that is not chemotherapy, it did not have chemotherapy toxicities, and yet most of the complete remissions could be without minimal residual disease. So that was good. Now, there are several black box warnings of this drug, and because it is a protein and it's a toxin, it has some unique toxicities that we don't usually think of in chemotherapy drugs. One of these is capillary leak syndrome, and the other is hemolytic uremic syndrome. So the capillary leak syndrome is something that almost all immunotoxins have. Because there are proteins, and they work by getting into the cytoplasm and killing the cell. And in order for them to get out of the bloodstream, it turns out the blood vessels are lined by living cells, which are called endothelial cells. And so in order for these molecules of the toxin to get out of the blood vessels, they go through these living endothelial cells. Once they get to the cytoplasm of some of these cells, they could kill those cells, and that could poke holes in the capillaries. That's not such a bad thing, though. We actually hope that that happens in that it allows the toxin to escape from the blood vessels, to get out and into the extravascular space where it can interact with some of the hairy cells which are outside the blood vessels. However, it does cause some leakiness. Fortunately, the Moxie has a short half-life, and so within a week after the last dose, the blood vessels are pretty well healed. But during that time of treatment, which really can be about the first 10 days of the cycle, because we give the drug on day 1, 3, and 5 of a 28-day cycle. During the first 10 days or so, patient can be quite leaky. What that means is that if they're not drinking enough water, they can get dehydrated. Now, there's another problem that seems to be unique with Moxie and does not seem to be found with other immunotoxins. For example, LMB2 targeting CD25 for T-cell leukemias. That's a different story that we won't talk about today. But it's unique that Moxie causes a syndrome of hemolytic uremic syndrome, which involves a decrease in the platelets and an increase in the creatinine. And this seems to be associated with some renal insufficiency that seems to be touched off by patients getting dehydrated. And so what we do to avoid the capillary leak syndrome as well as the hemolytic uremic syndrome is fairly simple. We avoid excess IV fluid, and instead we encourage a lot of oral fluid intake. In fact, we encourage up to a cup of water every hour in patients, and not to go more than 2 or 3 hours at night without drinking water. And so the way we kind of explain it to patients, and sometimes doctors to really understand this, is that the blood vessel system, the intravascular compartment, is kind of like a bucket, and the bucket has some leaks, and it's a slow leak. So if you don't add water gradually, you're going to get empty. But if you add a lot of water at a time, then you're going to overflow, and the overflow means that you're going to have edema, and you might have pleural effusions, you might have pulmonary edema, and that's an excess of fluid. So we find that if we're just using oral hydration, and it's slow, and we're actually using it through the night. Patients are not sleeping more than 3 hours at a time at night. It tends to be very tolerable, and it tends to prevent this capillary leak syndrome. We found that 3 out of our first 9 patients with Moxie got HUS, and of the next 17 patients where we followed these precautions with drinking water, only 1 patient out of 17 did. The last thing I'll say is that we find that some patients get nausea, headache, and sometimes fever with Moxie. This can cause dehydration, partly because the patients feel like they can't drink. And we find that as opposed to other anti-nausea medicines, low-dose dexamethasone, 4 milligrams orally, takes away this nausea very quickly. And the patients don't even need this more than once or twice during the cycle, and that tends to work very well. So these are the precautions that I would suggest in patients getting this drug to avoid the toxicities. It's a fairly different kind of therapy that we're used to in oncology, but it's one that can be very effective.